The meaning of panic disorder? This is a situation whereby you experience recurring panic attacks that are unexpected. According to DSM-5, panic attacks can be defined as intense discomfort or fears which peak in a few minutes. People experiencing this disorder usually live in the fear that they will experience panic attacks again. It is possible you are experiencing panic attack anytime you develop fears that don't have any clear reason. Physical symptoms will be experienced such as sweating, breathing difficulties and racing heart. There are people who usually experience the problem of panic attacks maybe once or twice throughout their lives. According to American Psychological Association, 1 person out of every 75 usually experience panic disorder. A major characteristic of panic disorder is persistent fear about experiencing another panic attack, most especially after going through one. It is the worry or fear about experiencing recurring panic attacks. Although this problem's symptoms are overwhelming as well as frightening, it can be managed and treated. If you want to improve your life and live normally, seeking treatment seems to be a very viable option that you can explore. Panic disorder symptoms. The various symptoms of panic disorder have been discovered to surface in people under the age of 25. In case you've had over 4 attacks or seem to be living in fear that you could be attacked again, it is possible you are suffering from panic disorder. Panic attacks do produce fears that come up in a sudden way. There will not be any warning. The time that an attack usually lasts is about 10 to 20 minutes. However, there are cases which are extreme whereby symptoms will likely last for about 60 minutes. Experience and symptoms vary with people. Some panic attack symptoms that are common are the fear that you're likely to die, chest tightness or pain, numbness or tingling in the feet or hands, mental state changes, trembling and shaking, sweating or chills, nausea, light-headedness, dizziness, vertigo, feelings of being choked, shortness of breath, palpitations or racing heartbeat. There isn't any clear reason why panic attack symptoms do occur. Typically, the dangers in the environment aren't in any way near the symptoms. Since attacks like these can't be predicted, your functioning may be affected. Through the fear of panic attack, there is every possibility of experiencing another panic attack. How a panic attack actually feels like. Listen to the stories of people that have experienced this problem in the past. What actually brings about panic attack? The causes aren't clear. Studies have shown that this problem may be linked genetically. Panic attacks can also be linked with those significant transitions that occur in someone's life. These could be having the first child, getting married, leaving for college and so on. These are major transitions which can bring about stress and also create unnecessary tension. Who can suffer from panic disorder? Although there isn't much information about the major causes of panic disorder, there are lots of facts to explain that some groups of individuals are more prone to suffering from it than others. For instance, National Institute of Mental Health has explained that women are more prone to experiencing panic attacks than men. Can panic disorder be diagnosed? Emergency medical care may be an option once you are experiencing panic disorder. Majority of those who usually experience this problem at first consider it to be heart attack. Various tests will be carried out by the emergency provider to know whether the symptoms are being caused by heart attacks. In order to ensure that other conditions are ruled out, blood tests may be run. Electrocardiogram (ECG) may also be used in checking how the heart functions. Once nothing is found in relation to the symptoms you are experiencing, you will then be referred back. Mental health examination will be carried out by your care provider. You'll be asked about the symptoms. Prior to making any panic disorder diagnosis, every other medical disorder must be ruled out. How can panic disorder be treated? Panic disorder treatment will focus on getting rid of the symptoms. Therapy is how this will happen through a professional. There are cases when medication will be required. CBT, cognitive behavioral therapy, is what therapy involves. It will be aiming to help you have a change in both your actions and thoughts. This will enable you to not only understand the nature of your attack but also manage your fears very well. Medications which are being used in the treatment of panic disorder do include antidepressant, SSRIs, selective serotonin reuptake inhibitors. SSRIs being prescribed or recommended for panic disorder include sertraline, paroxetine, fluoxetine. Some medications which can sometimes be used are SNRIs, serotonin, norepinephrine reuptake inhibitors, anti-seizure drugs, benzodiazepines, includes clonazepam or diazepam. MAOIs, monoamine oxidase inhibitors. This is a form of antidepressant but used rarely due to its side effects. Still talking about treatments, there are some home remedies which you can take in order to reduce these symptoms. Some of them are maintenance of regular schedule, regular exercise, getting regular rest, avoiding of stimulants like caffeine. What actually is the outlook on long-term basis? Panic disorder is an abnormal condition which isn't easy to treat. There are people who don't respond positively to treatments. Also, there are others who may not experience any symptoms at one point and then start developing intense symptoms the next time. Through treatment, most people are going to experience relief. Prevention of panic disorder may not be possible. However, the symptoms can be reduced through avoidance of alcohol and use of stimulants like caffeine. The same can be said of illicit drugs. If something which you once experienced in the past is bothering you, ensure to talk it over with your care provider. Also, try as much as you can to ensure that anxiety symptoms are noticed.